and welcome to Doctor Story, everyone. Who doesn't want to look good, isn't it? We all want smooth, flawless skin, beautiful hair, but unfortunately, a few of us are blessed with it naturally. From acne to brown spots to wrinkles, to excessive unwanted hair on one side to excessive hair fall on another. The list is long, perhaps endless. We all have some little imperfections that get in our way, leading to a negative body image and low self-esteem thereafter. So how do we help ourselves? We use cosmetics. Before we jump into the discussion, we all must understand what are cosmetics. Are these just lipstick, eyeshadow, blush, or nail polish? Yes, these are. These things are cosmetics. But so are other things like shampoo, body wash, skin moisturizer, hair gel, etc. Almost any product that you put on your body for the specific purpose of improving the appearance or feel is considered a cosmetic. And so today we have invited Dr. Annu Jayan, a reputed and well-established name in the field of cosmetic dermatology with more than 16 years of experience. She is the founder and director of Skin Essence, a leading skin and hair aesthetic clinic located in Kochi, Kerala. Dr. Jayan, thank you so much for joining in and a warm welcome to Doctor Story.
Thank you. It's a pleasure.
So, Doctor, let us start with understanding who is a cosmetic dermatologist.
Dermatology is your post-graduation after your MBBS. So after doing your MD or diploma or DNB in dermatology, recognized by the Government of India and recognized by the Medical Council, after that, if you have an experience in cosmetology, in cosmetic dermatology, then you can practice cosmetic dermatology, and that is what a cosmetic dermatologist does.
Okay. So what do you think are the factors that have brought revolution in cosmetic science?
I was doing my master's in dermatology. This is more than 20 years back. Cosmetic dermatology had just started in India, had just stepped into India. In Mumbai, if you ask me, that was the hub where it all started. As you know, the cosmetic industry or even the celebrity Bollywood kind of industry, the fashion industry, the hub in India is Mumbai. So that is where it all started. Because of the revolutionary changes which social media has brought in, this has spread all over the country, and now even the smallest towns have doctors practicing cosmetic dermatology in their own way.
Right. So when we talk about a cosmetologist, what's the difference between a beautician and a cosmetologist?
Well, a beautician is somebody whom you go to for your concerns, like let us say you have some excessive hair on your upper lip or your eyebrow, so you go to her for threading, or you go to her or him for your haircut. So this is something a beautician is trained to do. They have their own schools which they train to groom a person. They could be doing makeups, they could advise you on certain skincare also. But when it comes to your skin routine and the right products to use on your face to maintain the good skin that you have got, or to take care of any skin concerns that you have, then dermatologist is the answer. So your cosmetic dermatology is someone who is scientifically skilled and knowledgeable to understand and treat your skin specific to your concern.
Okay, well noted, yeah. So in cosmetic dermatology, I think laser hair treatment or laser hair reduction is the most common cosmetic procedure that we all know and is performed across the globe. So does laser techniques allow quick treatment options, in brief period, or it's just a myth?
Well, it is fine to have body hair, and it is fine if you're okay with it, you flaunt it. That is my take on it. But if you're somebody who wants to remove those unwanted hair, then you can choose to temporarily get it done by going to a parlor, by doing procedures like threading or waxing, or you can even do it at home by carefully using disposable razors and shaving, or even waxing kits at home are also available, or hair removal creams are also available these days. But make sure these are safe for your skin and they do not harm or damage your skin in any way. So a dermatologist will help you to do these procedures in the right way without causing any damage to your skin. Now, if you're looking for a permanent remedy, then this is not the answer. Because let us say you're going to parlor to do threading for your upper lip, and you are somebody who goes every week, then you will continue to do so, because threading is neither going to increase your hair nor going to decrease your hair. It is only going to remove your hair temporarily. Whereas laser will permanently reduce your hair. because it's a technology which targets the hair root and destroys the pigment inside the hair roots and makes sure that the hair becomes lighter, finer, and over the course of time, even less in number. So if you ask me, if you want permanent solution for unwanted hair, laser is your only choice. But there is another take on it. Like, let us say, most patients ask me, so when is the end? When can I stop doing laser and be hair free forever? So there are two answers to it. One is, let us say you're going to a parlor to do upper lip threading and you're going once in 5 days and you do not want even one hair on your face. Even doing 4 sessions of laser over, let us say, 6 months, your hair would have reduced by at least 50% or even up to 60%. So you might choose to go back to parlor for threading, but with a reduced frequency of maybe once in 4 weeks or 6 weeks. So the frequency of visiting a parlor for threading is drastically come down, and you can opt for that. Or you can opt to continue laser. Even that will be a reduced frequency. The advantage of continuing laser is with each session, the hair is still going to reduce. But whereas after laser, if you go back to parlor and stop laser, whatever results you've got with the initial 4 or 5 sessions will stay, but then it will not further improve with threading or so.
So if I don't want to go to laser after, how many sittings are required for the permanent hair removal?
If you do not have any underlying hormonal anomalies like polycystic ovarian syndrome or hypothyroidism, then your facial hair, you will need a minimum of, let us say, 6 sessions or 8 sessions to reduce it by 70 to 80%. So when body hair is concerned, let us say, if there is somebody who likes wearing sleeveless every day and she finds it painful or she finds it time consuming to shave every day on a daily basis, to wear sleeveless. So even after 4-5 sessions, the shaving would come down. The need to shave would come down drastically to, let us say, once in 4 weeks or 6 weeks. So continuing the session around 8 to 10 sessions will definitely make her so hair free that she can continue wearing sleeveless every day for maybe a month or more also. So she might have still around 8 to 10 hairs or so, but they will be extremely fine and will be visible only on closer examination.
So doctor, let us please help us understand what's the difference between regular cosmetic products and dermo-cosmetic products.
Regular cosmetic products, when you go to a shop and buy, you just listen to their advice and you buy. You really don't know what are the ingredients, and you also don't know whether it is suitable for your skin type. So depending upon your skin type, your age and your concern, the product which may suit your face will vary. Like, for example, retinol is a very commonly used anti-aging product. And it is something which really works wonders on your skin. But when you go to a salon, you do not know what is the strength, you do not know how frequently to use, you do not know whether it is going to harm your skin. So depending upon that, it is absolutely essential to go for a trusted product which has some medical science behind it, and also take the advice of somebody who is skilled and experienced in understanding your skin and advising you the right way to use it. So somebody with a dry skin, if I start on retinol, she will or he will come back to me with severe redness or other skin irritation. So it also falls on me to understand the skin and then advise, which is not possible when you are selecting a product over the counter from a random shop.
Right. So as you talked about, the physical aging, is it possible to slow down or reverse physical aging on human beings through, maybe medical or scientific intervention?
We're talking about skin. So what you see on the skin, the changes what you see on the skin as we age, it is not just on the skin level which is happening. It is from skin to your muscles, to your fats, to your ligaments, to your bones. There's a whole lot of changes which happen under the skin. And there is no way to stop it. There is, it is just wisdom, we grow with age. So there is no way to stop it. There is no way, I wouldn't say we can even, reverse it. We cannot reverse it also. But we can help the skin to age in a slightly better way, maybe slightly delayed. So these are possible only when you regularly visit a dermatologist, at least once a month, and make sure that your skin is having the right products and make sure that you do the right treatments for the face. There is no shortcut to good skin.
Absolutely. So if we talk about, the day-to-day activities, what would be, according to you, lifestyle habits or diet that affect the skin and its changes?
I'm someone who personally believes in a holistic approach to skin. So if you ask me, it all starts with the kind of sleep you have, whether you sleep continuously undisturbed for at least 7 hours on a daily basis, whether you drink enough water, whether you have enough vegetables and fruits in your diet, whether you take timely balanced meals, whether you're somebody who is more or less a happy person with happy thoughts. Are you doing anything to make sure that your mind stays happy? Do you have me time? Do you have a hobby which you love? How are your personal relationships? What is your professional background like? So it is very, very important to have a peaceful mind. Then and only then it will naturally glow in your skin. Well, the answer, the moment I tell this, my patients tell me, who doesn't have stress? Yes, we all have stress, but we need to understand that and manage it. So it is absolutely important for all my patients to have me time. So I tell that every day, even if it is for 30 minutes or at least 1 hour alternate day, you must do something which is to make you happy. And this is not something from which you're generating money. It could be gardening, it could be learning a new skill, it could be music, it could be Zumba, it could be yoga, but do something. And preferably, I insist that not with a family member, because there could be tensions, and which is fine. So it is fine. So to a couple, I say, the husband should have his or her own activities, and the wife should also have his or her own me time activities. Mm-hmm. So they join together, and then I feel the relationship also becomes more beautiful. Now, coming to skin, water is essential, vitamin C, fruit is essential, all the other nutrients from vegetables and proteins. So if you're a vegetarian, you make sure that you eat all the different kinds of dal. If you're a non-vegetarian, make sure that in addition to non-vegetarian, you also eat dal also. So make sure that you have all the proteins in your diet, and also make sure that you follow a healthy skin routine. So simple steps like not touching the face unnecessarily, washing the face 2 to 3 times a day, using a sunscreen. So the first product, if you ask me, which you must get from a dermatologist, is a sunscreen. And then the second product, depending upon your age, could be something for a lightening of the brown spots, could be for anti-aging, could be for dry skin. So you start with 2 basic products and then you gradually upgrade. I have a lot of patients who are just on sunscreen. I have patients who are on 2 or 3 medications only. I have patients who are only on medifacials. They just come to me only for that. So depending upon that, we can recommend, depending upon the patient's need, I can recommend what is needed.
Well, that's a very relieving, the advice. What would be that one habit that you think harms the skin the most? Or in most cases, you have seen that was the reason that, there were maybe some type of an irregularity in the blood or the skin. What would be that one reason or the cause that you think is the most harmful?
If you're not counting the lifestyle habits, and if you're not counting the dietary changes, if you ask me about the products, most of my patients who come to me, they are already on sunscreen. But what they do is they just apply the sunscreen once in the morning. They do not reapply it. So it is a myth that sunscreen, it is enough to apply once and then you can go out the whole day and you need not reapply. So that's a myth. So you have to reapply the sunscreen. That is a practice which most of my patients before coming to me have not followed. And just changing that will make a big difference. Otherwise, for dark circles, another habit most of my patients I have observed is they do not remove the eye makeup. So they think fancy makeup removers are needed. No, even a bit of coconut oil or olive oil is fine to remove the makeup. So make sure that you remove the makeup before going to bed, and make sure that you are wearing sunscreen every 3 to 4 hours at least, even in indoors, like the room I am in, this natural light. So if I'm sitting in the room, I have to reapply sunscreen every 3 to 4 hours.
Well, fantastic. Okay. Doctor, we would like to know more about your clinic now, Skin Essence. So what are the services offered there? What is the procedures that we follow, etc.?
So if a patient comes to me and asks me, what should I do for my skin? My answer is, why do you think there is anything needs to be done? So that is my first question to my patient. Reason being, if a patient asks me to choose, there could be 100 different things which I see. And the patient could be worried or concerned only about one. So I need to identify and understand that and then treat it accordingly. So if you ask me, I practice in Cochin in Kerala. So we have a humid climate here. So mostly I get a lot of teenagers coming to me with acne or pimples. Then brown spots or freckles is another concern again in young adults. Pigmentation or tanning is a concern among all age groups. Then, of course, as they age, there is lines and wrinkles, etc. So the treatment offered is initially only medicines which they can apply. A patient who comes to me, first and foremost, I do not advise any procedures. First, I tell them how to take care of the skin by doing some home care with the products which I recommend. And then I see them after 15 to 20 days, understand how this product has helped their skin. And if not helped, then understand whether there is any other underlying causes for it. If needed, investigate and find out whether there is any hormonal anomalies, etc. So for pimples, it could be just face wash and medicine, or it could be tablets, plus it could be some chemical peel treatments, etc. And even pigmentation, we do peel treatments, and we have even laser rejuvenation treatments for pigmentation. Again, acne scars is something which is very common. You have these scars, or like deep pit scars in face, or you have scars from chicken pox on the face. So that can all be very, that is something which can be very easily reduced to a large extent in a matter of just 4 months with lasers and stuff. So that is again something. But if you ask me, what I really love doing in my clinic is anti-aging treatments, because these are really, treatments which works wonders on your skin, and they give instant results. Like an acne patient, it takes time for the acne to improve. Whereas if a patient comes to me with the crow's feet, those lines, the crinkly lines which you get around the eyes. So I just do a botox injection, botulinum toxin injection for them, which takes only around, let us say, it's a 2 minutes procedure. So it's known as a lunch hour procedure, because I have patients coming in between work, during the lunchtime and going back to the work. And then the lines disappear in just a matter of couple of days. And those lines do not come back for the next 4 to 6 months. So if you ask me, that is my, absolute favorite thing to do in my clinic. Even the same for fillers. You can just get all these sagging skin sorted, or maybe a nice lip filler for a model who wants to have slightly, shapely, fuller lips with a nice cupid's bow, etc. So these are my favorite things to do in my clinic.
Wow. Okay. So lastly, there's this common belief that such treatments cost exorbitant charges. How true is that?
Well, India is basically a fairness market. Okay, so if a patient comes to me saying that, I want to become fair, I tell them that it is not possible for me or anyone to make you fairer. But if you have some pigmentation or tanning which has happened as a result of sun exposure or any other concern, I can make that better. So for that, it can start with something simple like a sunscreen or a medication at which they can use at home, which could be something very economical, which is, very pocket friendly. And I have even housemates who come to me with melasma or such concern, who are just on the products, because I don't want them to spend too much, because that is where the money is coming from. I know it is important. But whereas, let us say, if I have somebody who's in an industry where the face is a source of income, who is a model or who's in an industry like that, for them, I'll have to do more. So I'll have to do peels, I'll have to do what is known as glutathione injections, to make those pigment go away, which is a nice antioxidant. Glutathione is a good antioxidant which can reduce your pigmentation, which actually nourishes your skin. So in that case, it can go a little on the higher side. So you can choose, to have something which is pocket friendly, or you can choose to maybe spend a little bit extra depending upon your need. A bride who's getting married in 3 to 6 months will probably spend a lot of time and effort and maybe money in my clinic, so that she looks wow on her day. And after that, she may not spend so much, because that is done, and she might choose to not spend so much, and which is absolutely fine.
Right, absolutely. Well, thank you so much. We couldn't thank you enough for taking out time for this discussion. And I firmly believe our viewers will greatly benefit from our discussion today. Thank you so much, Doctor. Have a great rest of the day.
Thank you so much, Anshul. It's been a pleasure talking to you. I hope this helps at least to break some of the myths that some people have.
Right, absolutely. Thank you so much.